So up to now we have seen anterior cerebral artery, the middle cerebral artery, the AICA, anterior inferior cerebellar artery, PICA, posterior inferior cerebellar artery, and superior cerebellar artery. Now finally we will see a large artery, or it is a big branch of the basilar artery, and also the termination of the basilar artery in form of posterior cerebral artery. So posterior cerebral artery is a big artery and arising from the termination of the basilar artery. Mainly the artery is for the occipital lobe of the cerebrum and part of the temporal lobe. So here we can see the termination of the basilar artery and formation of the right and the left posterior cerebral arteries. In the upper part of the pons, the artery is basilar artery and running in the anterior median sulcus of the pons. So posterior cerebral artery, and in its proximal part it is receiving the posterior communicating artery, which is a branch of the internal carotid artery, and finally completing the polygonal arterial circle known as circle of Willis or circulus arteriosus. Initially, the artery is running laterally and backwards behind the cerebral peduncles and reaching in the tentorial area. In the tentorial area, the artery is dividing in temporal branches and in occipital branches, but the artery, in same way as we have seen the anterior cerebral artery and middle cerebral artery, is giving some central branches and also cortical branches. And artery is having three parts in neurosurgical nomenclature. It is having P1, P2 and P3. P1 is the part from its beginning up to the part of artery which is receiving posterior cerebral artery. P2 is the part in the perimesencephalic cistern, and P3 is the part of artery which is lying in calcarine sulcus. So artery is running backwards and laterally, and in this part, in tentorial part, dividing in temporal branches and the occipital branches. The temporal and the occipital branches. So the vertebral arteries are the arteries for the brainstem, cerebellum, the occipital lobe, part of temporal lobe, and part of the diencephalon, basal ganglia, and some part of the internal capsule. So these are the temporal branches. And these are occipital branches, sometimes also known as the internal occipital branches. So this is the posterior cerebral artery, the temporal branch, which is dividing in anterior temporal and posterior temporal, and these temporal branches are supplying the uncus, the parahippocampal gyrus, the medial and lateral occipito-temporal gyrus. So anterior and posterior temporal arteries, which are branches of posterior cerebral artery, are supplying to the uncus, the parahippocampal gyrus, the medial and the lateral occipito-temporal gyri. The occipital branches are supplying the occipital lobe, and it is having the PO artery, parieto-occipital artery, and the calcarine artery running in the sulcus of the same names. The parieto-occipital artery is supplying the precuneus and cuneus area of the occipital lobe and part of the parietal lobe. This calcarine artery is arising from the internal occipital branch and running in calcarine sulcus, and it is supplying blood to lingual sulcus and cuneus sulcus, lingual gyrus and cuneus gyrus. Especially this calcarine is clinically very important, and it is also supplying blood to the primary visual cortex, the area number 17. When this artery is occluded or ruptured, it can lead to contralateral homonymous hemianopia. So artery can lead to contralateral homonymous myopia, but the macular vision remains intact. So these are the cortical branches of the posterior cerebral artery. Now there are some central branches in the same way as we have seen the anterior cerebral artery and posterior middle cerebral artery. These central branches are supplying the thalamus, the part of posterior limb of the internal capsule, the part of globus pallidus, putamen, amygdaloid body, and some other subcortical areas.